diagnose some serious diseases from the face. There's only one problem, and that is traditionally facial diagnosis was not used to diagnose diseases. It was used to diagnose symptoms, okay? So I actually don't go around diagnosing diseases, but I wanted you to see the diseases and see what symptoms are involved, so I will teach you that. I don't go around to look at someone, because someone comes to me and I say, oh, you have cancer. In fact, I'm very careful not to say it, even if I know they have it. Because, first of all, I'm not a doctor. Second of all, I'm not an acupuncturist. I'm a specialist in facial diagnosis that I learned from my Chinese grandmother. Her family passed it down for many, many, many generations. So I have a long lineage of people who did facial diagnosis and face reading for business. So it's medical and business oriented. So what I want to do today is talk to you about some of the very specific signs that you can learn about and go use in your practice immediately. That on Monday, you can actually start looking at people going, oh, there's a lot more pain in that person's face than I thought there was. Or, oh, the kidneys are a little bit inflamed, or the liver is definitely, acting up. So I want to show you some of those signs with photographs. And I want to give you some basis of understanding about why the face shows this so well. And we will look at some people who are seriously ill. Some of my students tease me because I go through the internet collecting photographs of dead movie stars. But I don't know who else to collect because that's who I could find. Now, let me explain to you how I work with a patient who does have a serious disease, and I get a lot of them. I'm very well known for my facial diagnosis work. If someone comes to me and asks me if they're sick, I don't say, yes, you're sick. In fact, what I do is ask them if they are sick or how they're feeling and have them tell me, and I will validate their symptoms and their diagnoses often with the markers in the face. To give you an example, I had a client, I was actually doing a clinic visit with one of my longtime students, and it was a really weird day. He didn't tell anybody I was coming. I just came in, and we made the session slightly longer, where I talked to the patients for a little while. He treated based on the diagnosis that I came up with, and we had a really interesting couple of sessions because we had 3 vulvodynia patients in one day. Now, vulvodynia is not very common, and 3 in one day is odd. It's very odd. And I was a little bit alarmed because I've never worked with vulvodynia, and I wasn't really sure exactly what to look for. The first patient very clearly showed redness in the vulvar area. Okay, it was vulvar area. It was very easy to see that certainly there was some kind of pain going on there. And that was an easy read, and so we worked with her in certain ways. But the other 2 were very interesting to me because the one, she wasn't showing anything here at all. And she was showing a lot of red in her chin, a lot. And I said to her, are you sure you don't have something going on with your bladder? And she said, oh, yes, I have interstitial cystitis also. And I said, well, I have news for you. I think you've got some nerve stuff going on with interstitial cystitis that's actually being diagnosed as vulvodynia. And so I really wanted to work with the bladder instead of working with the reproductive organs and the points for that. So the third one was even more interesting because it had no symptoms whatsoever in the face. She has vulvodynia, apparently. She has definite pain in that area. She doesn't have any sex. She doesn't want to have any sex. There was the clue. And I said to her, well, why don't you want to have any sex? And she said, oh, well, I was abused. Well, when you have a post-traumatic stress disorder based on any trauma, it's going to lodge often in the place in the body where the trauma occurred. So what she has to do is do some psychological work. I sent her to a therapist to work on this because she's got sexual abuse issues that are causing the vulvar pain. And it didn't show up as a physiological symptom. It's actually a psychological symptom. That doesn't mean it's not real, but it means that it's based on something very emotional. And she has a lot of spasms in that area because that area is still so compromised in terms of the holding pattern of the emotions that are there. Okay? So it was a really interesting day because one clearly had vulvodynia. One clearly did. It was definitely this red. She had issues underneath it too, but they were easy to find. But the other 2 were very, very different. So when I see people, I work with some interesting stuff. I get all kinds of stuff. I want to give you some basic tenets of facial diagnosis. The way that I work is I work a lot with the psychological and emotional underlay of disease. I certainly understand that there are diseases that are caused by all kinds of factors. the environment, our diet, you know, predispositions that are based on heredity. But I have a problem with people who base their health conditions on their genetics. And the reason why is if you read the newest information in epigenetics, which I think everybody should read, it's very, very clear that you may be predisposed to illnesses. We all are, you know, and we all have things in our family. And we certainly are raised with those people so that we act in similar ways and we eat in similar ways. You know, we do all these things that are very similar, so of course we're set up. But if you choose to go a different way, you may not get that disease at all.